Hi everyone. I want to talk to you today about what the Watchman device is. I will probably do a separate video talking about atrial fibrillation itself, but one of the issues for people that have atrial fibrillation is there is some risk of forming a blood clot inside of the heart when you're in atrial fibrillation, and what we really worry about is clot forming and then going out to the body and causing a stroke. We're able to estimate what an individual's risk of having a stroke from atrial fibrillation is by looking at certain risk factors, for example, their age and if they have diabetes or high blood pressure, things like that. If the risk of stroke is high enough, we will typically recommend taking a blood thinner of some sort, such as warfarin or Coumadin, or one of the newer medications like Eliquis or Pradaxa or Xarelto. The Watchman device is essentially an alternative to taking a blood thinner like that. It has been shown to provide similar protection against having a stroke as being on one of those blood thinners. So for people who have problems with being on a blood thinner long term, for example, if they've had like a GI bleed, or if they frequently fall, the Watchman device can be a good alternative for those people. The Watchman device looks like this. And basically it's essentially a plug that gets put inside of the heart to seal off the area where, if you were going to get a blood clot from atrial fibrillation, that's the area where it would most likely form. That structure is called the left atrial appendage. It's like a little outpouching of the top chamber of the heart on the left side. So basically the Watchman device gets put into that area to seal it off, to protect you from forming a clot there and ultimately having a stroke. The way that it's put in, so typically the patient is under general anesthesia, so they're fully out. The cardiologist would then come in through the femoral vein by making a puncture into that vein with a needle, and then that basically lets you go up with this long tube up inside of the heart. A small puncture is made in the inner atrial septum, basically the wall between the two top chambers of the heart. So you come up through the veins up into the right side of the heart, poke through that atrial septum, and then come across and put that Watchman device into the left atrial appendage. The positioning of the device is done through a combination of looking at an ultrasound image that's obtained by doing a transesophageal echocardiogram, and I can make another video where I talk about that. But it's basically positioned using the imaging from that as well as X-ray, and the procedure typically takes, I would say, anywhere from 20 minutes to maybe an hour and a half at the long end. Folks usually stay overnight in the hospital one night and then go home the next day. You're typically on a blood thinner like the ones I mentioned for about 6 weeks afterwards, and then another transesophageal echocardiogram is done to check the device. Assuming it looks good, the blood thinner is stopped, and then typically you take a full 325 milligram strength aspirin and a second medicine called Plavix, and then that's done for another 4.5 months. After that, the Plavix stops, and then you're just on the aspirin indefinitely. Well, I hope the information in this video is helpful to you. If you did find it useful, please hit the like and subscribe buttons. Thanks for watching.